With the introduction of the 5G network across the country, the usage of the network communication has also expanded in various fields. We are currently reporting from the Pragati Maidan, where India Mobile Congress, the 6th edition of the same, is currently underway, and we are reporting from the Jio counter, where you can see that this is the first of its kind ambulance which is digitally connected. In fact, we have been told that the usage of 5G is better used, and it is going to be a major breakthrough in the cases of the emergency and the accidental cases as well. This is one such ambulance which you are seeing on the screen. It is digitally connected, and the doctor will be available for the patient who is in the dire need, and he is going to be connected through the 5G network. So these are the visuals, and this is the demo piece which is available here at the India Mobile Congress. Also, you can see that there is this big screen which you can see there is one doctor which is connected. Inside view as well you can get in the same, and then there are the other vital parameter as well of the patient. To talk more on the same, we are joined by Ashish Bhatnagar from the Jio platforms. Sir, thank you so much for speaking to us. Can you take us through as to how this vehicle is different from the usual vehicle which are out there on the roads?
Okay, so first I would like to tell you this 5G is bringing a revolution in India, and with this kind of a use cases or a product, we can save lives. So what we are delivering to the Indian environment or Indian medical practitioner, this kind of a scenario where sitting remotely they can monitor everything over the 5G network. As you are seeing, doctor is placed remotely and the ambulance is there on the road, and she is providing all the guidance to the paramedic who is not so skilled to operate the patients, which means they are helping in saving lives. The 5G is bringing an evolution, and as you can see, there are vitals of the patient which are getting scanned in real time.
This is the particular screen which we are also seeing. Can you please take us through as to what this small screen is all about that the viewers are seeing here, sir?
Yeah, so this you are seeing the ambulance which is standing right now. It is sending you a live feed, which is a kind of a view of a senior doctor who is sitting in a hospital, for example, right? And there he or she can see the inside ambulance view, which is a live feed coming, and all the patient vitals. Right now it's happening through 5G, and there we are saying like using 5G we can define the quality of service, which means I can dedicate the high throughput and low latency for all these kind of a use case, which means in the mobility scenario where ambulance is running on the speed of 80 km per hour, I can supply the dedicated bandwidth, and which is not possible in 4G. So this is what we are bringing as a true 5G revolution in India from Jio.
Okay, so we can call it in a way also that this is going to be a major path breaking and a breakthrough vehicle in the emergency cases. So this is only possible through the 5G networks, right, sir?
Right, you're absolutely right.
And also, by what time can we see these kind of special vehicles be running out there on the roads in the cases of the emergency, attending all the crucial patients?
This will happen very soon. As you heard our chairman, we have a vision to deploy 5G in all metro cities by this year end, and next year mid everything will be available in India. So which means we are going to connect all taluka, tehsils and the villages in India where this kind of a primary healthcare service is deployed, and people sitting remotely can monitor even the patient who are now experiencing challenge in getting the quality medical service in the village. So which means the remote doctor who is so skilled sitting remotely can monitor at least 10 to 15 patients at the same time. That's a revolution we are going to bring.
Clearly, Ashish ji, this is one of the thing which is very unique in its way. Also, walk us towards that side. We have seen another interesting thing as well on the left hand side. I would urge my camera person Pramod Kumar to go through that particular end where we are going to show you the robotic ultrasound technology which has been introduced by the Jio platform as well. This is the particular thing. This is the new device that we are seeing on the screens for the very first time on network 18. This is the laptop you can see, and then there is this dummy piece as well. There is this big screen which has been connected, and the robotic ultrasound machine is what we can see right here at the Jio platform mart, which is currently underway. Ashish, take us through all the details as to what we are seeing currently on the screen.
This is a Tele Radiology setup, which means you heard and you have seen, in fact, in the time of pandemic where the patient and doctor all were scared and they were not even able to go to the near to the patient room. So this kind of technology is bringing a revolution where sitting remotely or in a console room, doctor can operate the ultrasound or any kind of a radiology operations over the patients. And it can also perform the x-rays and other radiology processes. So what you are seeing here, there's a dummy of the patient, and sitting remotely, doctor can perform this action. And when he or she is moving the arm of this particular haptic device, this is basically telling him where to run and where how to scan it, and the whatever pressure.
So just hold on your thought to it. The extra machine that we are seeing here, this has to have with a doctor, sir, right?
Yeah, this unit will be at the doctor's end, and the patient will be sitting remotely anywhere in the village. So you can see there's a kind of procedure also getting explained in this TV screen. So like this, patient will be there in the remote clinic, and paramedic will be just assisting him in terms of giving the primary healthcare services. And the doctor sitting remotely can operate this particular device and move around this robotic arm. And the 5G, what 5G is bringing revolution is the latency, the quality of service. Less than 25 milliseconds, that's we are promising. And sitting remotely in real time, I can operate this kind of a robot. And whatever pressure patient is feeling, his or her body, the same can be felt by the doctor sitting remotely. So there.
But sir, when you talk about the rural segment as well, this is one such big thing, and at the same time comes the talk of affordability as well. How confident is the Jio platform that in the less time the technology like this will be sent towards the remote locations and it will be affordable as well at the same time?
So we are already ready. We have our preferred partners who are into this space, and we believe very soon we will be rolling out or supporting government or public institution to deploy this kind of a solutions. We have everything ready, only we need some kind of a space where we can deploy these solutions at village places or remote places and perform all these kind of a quality health services and give it to our 65% of Indian population who is right now staying in a rural area.
Clearly, this is the technology, the use of the technology which we are seeing currently. This is the first of its kind radiology, which we have been told by the Jio officials that soon it is going to be deployed in the rural places as well, where the doctor would be able to virtually assist the patient and to continue with the radiology and the other necessary ultrasound as well, which is one of the many things that will be performed by this robotic device. With camera person Pramod Kumar, Nikhil Lakwani for CNN News 18.